So we're doing febrile convulsion. Febrile convulsion. A lot of people out there call convulsion, what we call convulsion in medicine, as epilepsy. But because of stigmatization, we call it seizure. Seizure. It can also be called convulsion. Now, what is febrile convulsion? Febrile means fever in medicine. So febrile convulsion is having convulsion at the peak of fever. Who are those affected who are at risk? So there is an age bracket. Why? There is a theory supporting this, that the brain maturation occurs around 7 to 8 years of age. So children who have not attained brain maturation are prone or predisposed to convulsion at the peak of fever, because the sites that control fever is in the brain, called the hypothalamus. The hypothalamus in the brain control fever. However, in children below 7 years of age, their brain is not matured. So when they have fever, there is a trigger of cascades that go on that could lead them to convulsion. So the age bracket for febrile that could come down with convulsion at the peak of fever is 6 months to 6 years. Why are we worried about this? Why are we concerned about this? This is the thing. Here is the thing. When a child convulses, the child loses a percentage of the brain function. About 5 to 10% of the brain function is lost, and sometimes lost forever. One convulsion put the child at risk of another convulsion. So we don't want the child to convulse. If the child has had multiple convulsions, there are some capacity and some potentials the child could become, or the brain could do for in the child's life. The child may not be able to attain such height because brain function has been lost. So if you have a child is feverish, 6 months to 6 years, expose the child, sponge the child. You could give an antibiotic, ibuprofen syrup or paracetamol syrup, and then the least you could do is to rush the child to the hospital. Do not self-medicate. Febrile convulsion is real. Remember, if you know better, you will do better. Subscribe and keep watching. Thank you.